Welcome to Bowen Health and its subacute care services. These services are offered at multiple sites across Geelong and include the MCKELLAR Centre in North Geelong, the Sunrise Centre in South Geelong, Belmont Community Health Centre in Belmont. All sites are at ground level and easily accessible. This is a virtual tour of these sites with the aim to provide valuable information on location, services offered and eligibility, rehab team members, OT programs and referral pathways. The MCKELLAR Centre is located at 45 to 95 Ballarat Road, North Geelong, and provides inpatient and outpatient community rehabilitation services as well as GEM at home. The Sunrise Centre in South Geelong is located at the GMHBA Stadium, Cardinia Park precinct, near Gate 9, with entry from Kilgore Street. This centre provides outpatient rehabilitation services to people following cardiac surgery and people diagnosed with cancer. The Belmont Community Health Centre is located at 117 Reynolds Road, Belmont, and provides outpatient community rehab services. At the MCKELLAR site in North Geelong, there are 2 new buildings under construction. the MCKELLAR Mental Health and Wellbeing Unit, and the MCKELLAR Kids Rehabilitation Centre. Inpatient Rehabilitation IRC is located at the MCKELLAR Centre, 4595 Ballarat Road in North Geelong. It is a 100-bed inpatient rehabilitation centre for people recovering from an injury, illness or following hospitalisation from a surgical or medical procedure. They are divided into North, Central and South wings. The streams include general rehabilitation, generally under 65 years old, neuro, stroke patients or other neurological conditions, MS, GBS, Parkinson's and ABIs, GEM, over 65, complex medical issues and or functional decline, slower stream and more focused on the evaluation and management, orthopaedics, post-joint, repair or complex fracture, trauma, rehabilitation and discharge planning post-episode of trauma, multi-trauma, orthopaedic, brain or spinal cord injury, amputee, rehabilitation and discharge planning post-new amputation and revision of existing amputation. It also has a palliative care stream and private patients can also attend. OT-specific activities include upper limb and arm action groups, breakfast group, light meal preparation, flat trials, wheelchair training and practice, cooking and domestic group, falls prevention and energy conservation. Eligibility includes medically stable and allied health goals documented. Active goals to achieve within an appropriate time period and engaging and happy to participate, and cognitively must be able to engage and follow commands. Referral is from the University Hospital Geelong, other metropolitan hospitals, GP, medical specialist or any health profession. Gem at Home is also located at the MCKELLAR Centre, 4595 Ballarat Road, North Geelong. It is a multidisciplinary rehabilitation service provided in the home for a 2-week period. It provides programs to maximise independence and reduce the likelihood and duration of a hospital admission. The team includes geriatricians, registrars, pharmacists, occupational therapists, physiotherapists, dietitian and a nurse. Common patients accepted into this program include those with early stages of chronic disease, resolving delirium or mild to moderate cognitive impairment, those needing help with medication, minor trauma fractures and wound management and healing. Eligibility is generally over 65 years of age, achievable goals within a 2-week time frame, live within 25 to 30 kilometres of the MCKELLAR and BELMONT community centres, consent to daily visits and eager to participate, must be able to receive care safely within the home. Limitations include a history of violent and aggression or living in an unsafe household, severe cognitive impairment, severely limited baseline of mobility. A cost is usually $10 per day, capped at $30 per week. TAC and work cover will cover costs if people have an approved claim. Referrals are via a GP, a medical specialist or any health professional. Referrals should include a summary of a person's medical diagnosis, current symptoms and issues, goals for rehabilitation and other relevant risks. Referrals are via email, fax, electronic referral or by phone. MCKELLAR Community Rehabilitation Centre CRC is located at the MCKELLAR Centre in North Geelong. It's an outpatient rehab centre for clients recovering from an injury, illness or following hospitalisation from a surgical or medical procedure. Primary clients seen include amputation, burns, complex fractures, multi-trauma, spinal cord injury, stroke and other neurological conditions. Community rehabilitation is time limited and all clients must have a rehabilitation goal. Rehabilitation can be provided in the centre individually or within a group. Work teams are made up of allied health, medical and nursing professionals. Eligibility for the CRC is people recovering from injury, illness or following hospitalisation with rehabilitation goals. There's a cost of $11 per day and referral is via a GP, medical specialist or any other health professional, and referrals are received via email, fax or post. The Sunrise Centre, located at the GMHBA Stadium, is a state-of-the-art exercise and rehabilitation centre providing specialised services. It provides a range of outpatient rehabilitation for people following cardiac surgery and people who've been diagnosed with cancer. The oncology rehabilitation provides tailored specific exercise and education and rehabilitation interventions in the community. Prehabilitation during cancer treatment and in the survivorship phase. The team is a group of allied health professionals including a physiotherapist, occupational therapist, exercise physiologist, and they work closely with dietitians, speech pathologists, psychologists, social workers, audiologists and medical and nursing team. Services can be offered face-to-face, telehealth, individual or group programs. OT-specific activities include facilitation of cancer wellness and managing cancer, facilitated discussion and education programs, assessment and management of cancer-related fatigue and cognitive impairment, and return to meaningful, productive roles including work and parenting. Eligibility: people with or recovering from cardiac surgery or diagnosed with cancer. There is no cost. Referral is via a GP, medical specialist or any health professional. Referrals are received by email or post. Belmont Community Rehab Centre, CRC, is an outpatient rehab centre for people recovering from an injury, illness or following hospitalisation from a surgical or medical procedure. Primary clients seen include orthopaedic, general medical, geriatric, vestibular and pulmonary and neurological conditions including stroke, Parkinson's disease and MS. Community rehabilitation is time limited and all clients must have a rehabilitation goal. Rehabilitation can be provided in the centre individually or within a group. The work team is made up of allied health, medical and nursing professionals. Some of Belmont CRC's OT-specific activities and programs include upper limb rehabilitation including SABO, eStim and Sense-E, upper limb group, cognitive rehabilitation including memory group, return to work, return to domestic and cooking tasks, home assessment, LSVT Big and community access. Eligibility: people recovering from injury, illness or following hospitalisation with rehabilitation goals. The cost is $10 per day, capped at $30 per week, and the referrals are via GP, medical specialist or any health professional, and referrals are received by email, fax or post.